You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. According to my first guest, if you are missing one tooth or a few teeth, and especially if you're missing all of your teeth, you have to hear what he has to say. What you need to know about dental implants. Dr. French, welcome to the program.
Hi, Randy. Thank you.
Now, for people that don't know you, tell us a little bit about your practice. You're a periodontist.
Yeah,
is that right? So
that's
what do you
right.
do? And I guess most people, other dentists, refer you
Periodontist basically is somebody who's specialized in periodontal studies, which is the tissue surrounding teeth,
Okay.
so bone, gum, and also will have had some graduate level training in implant dentistry. So, the kind of patients that we might see every day would be, patients missing one or two teeth for, replacing implants, or sometimes bone grafting procedures or gum grafting procedures, like we can cover up recessions. Think of that like the plastic surgery of dentistry, basically.
Dental implants. That's what we invite you
Yeah.
to talk about today. How long have you been in and around dental implants?
So back in 93, when I did my grad studies, I went to Chicago at one of the original training centers for Brånemark, which was the original implant system that actually had science behind it. And so I learned from one of the masters back then. And so I've been doing it since, and really have established my practice probably within about 5 years, where the 80 to 90% of what I do in a day is dental implants.
Is that right? Now, why do you like it so much?
I think it's...
Because we talked on the phone.
Yeah.
I mean, you were excited about dental implants this topic.
Yeah. I mean, I was excited back in dental school even. I looked at this and I thought, this is where implants are going to be where dentistry is going to go, in the sense that instead of taking existing structures and trying to make them work and last, because we used to have to fix teeth until they break and fail, we can actually replace whole structures and start over again. And I think that it's been a tremendous benefit to dentists. And certainly there's the upside to that is, especially most recently, there's been more innovations where things are less invasive and shorter times as well.
Okay, good. Now today, I have a lot of questions about, because you say it's a buyer beware market.
Yeah, we were talking a bit about that. See, like anything in any field or any science, I guess you have potential for failure. And I think
failure means
failure.
They fall out.
Yeah, failure.
Or they get infected.
Sure, yeah, failure
Okay.
could be that extreme, or it could just be minor complications where the case might not have been planned properly, and there's consistent screw loosening rates or some kind of minor technical issue. But that rate can be anywhere from, say, 5% to 50%, depending on the type of prosthesis you're looking at, the type of implant, and those kind of factors. So I think it's important that when patients are looking at implants, they need to think, what's the risk, what's the success rate,
Okay.
What's the training, what implant system. There's, I think Benon looked at that. There's something like about maybe 300 or 400 different systems on the market right now. It's lots out there.
So for the denture wearers, just for a moment, we've talked a little bit how no more dentures, that the future of dentistry, that all denture wearers may have dentures that are attached to something. Could you elaborate on that?
Yeah, for sure. So if you want to get rid of dentures completely, you would need a minimum of 4 implants. And what you can build is like a structure on 4. Think of it like 4 rooms of a room, and you've got 4 walls. And that structure goes around the arch, bolted down on top. Now, 4, though, is kind of like your minimum number, because let's say that you lose 1 implant, and again, it can happen. So all of a sudden, you've only got 3, so now you don't have a fixed structure. So if you're thinking fixed, and that means not coming in and out at night, then you want to be probably more like 6 or 8 implants where you're building structures and you build in some potential for complications down the road. But you can do all on 4, and you can do, bolted down systems. And maybe you don't want that. Maybe you just want a denture that's more stable. It doesn't pop out when you're blowing out birthday candles like we were talking about with my family member.
You're going to have to tell that story, by the way, before you go, but continue.
Yeah, so, then you might just say, oh, I only want to do 2 implants on my lower denture and just put a bolt or a snap cap. It's almost like a trailer hitch. Denture goes in, snaps on top, and it holds it in place well enough.
No more adhesive or anything like that?
Yeah, exactly, and no more
and
sore
they can
spot.
eat whatever they want?
Yeah,
Or
yeah.
most things?
Well, let's say if it's a denture on 2 implants, then you're going to have still some of the limitations where there's some mobility and food gets underneath. If you really want to go to eating and doing everything like you want, then it's fixed.
Okay.
And that's just like teeth. It's also, allows you to taste food better, because you don't have the plastic covering the roof of the mouth or, down around the floor of the tongue. So you can enjoy your food again. So, hot dogs and and corn on the cob, and all those kinds of
Okay.
things that you'd be biting through. Apples. That's why you always see green apples on dental ads, right? Because they can actually crunch into something again.
So your father was
You know,
laughing or something, or blowing out candles?
My father-in-law. We were in Boca Raton in Florida or whatever, and it was a Christmas holiday when we take the kids down there to visit, and it was maybe a New Year's Eve or something, and a cake came with some candles, and he went to go blow it out, and the denture flew
You were
on-
there to see
flew
this?
onto the cake. Yeah, he's a pretty good spirit though, so he actually had a good laugh about it. But again, for some people that might be embarrassing.
Fix him up a little?
Oh yeah, we did. Yeah, we ended
do
up
for him?
we did 4 implants, and we did a bolt down system for him.
So like a snap-on denture?
No, in this case, it was a bar system that locked onto a bar. So it was a denture, but it was very stable because it's locking onto a bar.
Is this the kind of thing where they say I should have done this years ago?
Yeah, and in fact, that's what he did say. Yeah,
that right?
absolutely. But I think he was waiting till I graduated. He didn't want somebody else to do it.
Okay, now back to you about dental implants, because we're talking about what could go wrong today.
Yeah.
Which isn't the most positive things to talk about, but I think you say people need to know about this.
Yeah.
But you publish articles about this.
Well-
you lecture to other doctors about this.
Yeah, actually, I just gave a lecture to like 100 dentists in Calgary just I think about a month ago on failing implants. We have a database where we track over 8,000 cases right now, and what we did was we went back and looked at all the failures that we've seen, and so we had 91 implants fail out of that 8,000 something. So like basically 1.5%. But I include in that same lecture a whole series of cases that we see, because we get referring cases for failing implants, and a lot of times you can look at the case and say, well, this was probably failing because it might not have been planned properly, or something about that implant design, or certain factors about the way the case was managed. Maybe it was done as immediate when it might have been better as a delayed case or something like that.
So is it technically demanding? I mean,
Absolutely.
The more you do, you're
Yeah.
that much better now than you were 10, 15 years ago.
Yeah,
when
yeah.
you did this.
I say to myself all the time, it's quite surprising how complex implant dentistry is. I teach it sometimes to the general dentists. Used to run a program where we did a mentorship, and one of the guys said, it's just like a wood screw, right? And it is technically just like a wood screw, but there's a lot of other factors that go into it, and it's not just the actual, putting the implant in the bone. Let's call that the easy part. It's when to do it, when not to do it. How do you treat and plan the case? What else is going on with the patient's case?
Now, here in the United States, there's a big push. In my show, and I'm interviewing medical doctors and dentists, and I only hear the good stuff. And you're one of the first guys that said, Randy, there's a lot of things that could go wrong that I'd like to be on your program about.
Yeah.
But there's a big push for getting it done fast and teeth in a day. And I wanted actually you to talk about that stuff.
Yeah.
And you had to slow me down.
I said, whoa. Yeah.
So elaborate on that. And why is that potentially a problem?
Well, first,
Is that happening in Canada
yeah,
as
yeah,
well?
for sure. Yeah, it is. Yeah.
Like teeth in a day or that same
Yeah.
hour or
Well,
whatever?
the idea of getting everything instantly. I mean, and it depends too on what kind of case you're looking at. But effectively, most of that advertising for that kind of teeth in a day scenario is a full denture bolted on implants. So you take out all the teeth that may or may not be failing, and then you put in 4 implants or 6 implants, and you bolt the denture down over top of it.
Okay.
So one of the problems with that is basically you end up having to take the case from maybe having some teeth to having no teeth and converting it to full implants. So in some cases it might be that you could save teeth. The other question is, why are you losing the teeth? Right? If you're losing
That's a good question.
Well, it's a really good question. So if you're losing your teeth because of cavities, then implants are a great choice, because implants will never get a cavity. But if you're losing your teeth to gum disease, and that's like smoking and diabetes are also risk factors there too, then you're going to go ahead, take out infected teeth, put implants in a socket that's infected.
But if it's a bacterial infection, doesn't the bacterial infection live on the tooth root? And when the tooth comes out?
It's in the tissue too.
Oh, really? Okay.
Yeah, yeah. I mean, we were just talking about lasers, whether they can decontaminate tissues or not. If you go ahead and if you take an infected site and you pull out teeth and put implants in that socket, how do you know you've got the bacteria under control?
So you could still get an infected dental implant.
You can even have
titanium?
you can even have the bacteria on the tonsils for a while after.
Interesting.
And they
Okay.
can reinfect sites at other sites in the mouth. So what you do is you go from a periodontal disease case to a periimplantitis case. The other problem is when you take a denture and you bolt a denture on a stick, basically, or you bolt it on here, you don't want air underneath it. Otherwise, you're going to whistle, right? So you got to take that and you got to push it tight up against the tissue. And that means you got to, clean under it really carefully. So if you got someone who has gum disease, maybe because you know, they don't like going to the dentist, they haven't gone to the dentist, they're going to just get all their teeth out and get this solved in a day. And then 4 or 5 years later, they haven't been able to clean under the denture because, you know, again, they're not going back to the dentist for follow-up.
Okay.
All of a sudden, you know, hey, they got some bone loss around these implants, and oh, there's only 4 implants. What happens if you lose one?
But that's got to be rare, where these implants don't last.
No.
Like, how often do you see it in your
Well,
practice?
published numbers.
Like where you help people with
Oh, you mean how many?
failing implants?
Yeah, well, okay. That's a good question, because we used to get, say, 5 or 10 years ago, about maybe 1 case a month or even every other month, a referral for a failing implant. But just in the last, say, 6 months, we've been tracking these cases coming back, and we're seeing, like this last while, we've been seeing 2 cases a week.
2 patients a week
Yeah.
that have implants that...
Well, some complication where the either implant's failing or failed. You know, I mean, failed is it's...
Meaning you got to take them out?
Take it out. And failing, sometimes we look at it and we say, well, we can save it by doing some flap surgery or, you know, bone grafting. But sometimes we look at it and say, well, we could save it, but it's, you know, A, the wrong system, B, it might have been badly angled, or, you know, something might have been wrong with the planning, and we just go ahead and replan the whole case.
But for dental implants in Canada, do they need a referral to see you?
No, although we work...
So they can call you directly?
I mean, 90% is coming from a dentist, and that works well because usually the patient will come already knowing what to expect. But if they wanted to come on their own, you know, they certainly could. They can contact the office, and the staff is pretty good at trying to, you know, on the phone, help them decide whether or not their case is feasible. We go ahead and book an exam.
What should you ask? Somebody's considering dental implants.
Yeah.
What do they ask the dentist?
Well, you know what they need to do is first ask, what is my case? Is my case easy or is it hard? Right?
Okay.
And if my case is easy and the general dentist has had a lot of background in placing, you know, you could ask them, how many have you done? Okay. And more important, how many have you done? How many have you actually tracked? Or how long have you seen your cases? How long you've been doing it? So
you can say, have you been doing this for 10 years or 15 years or whatever?
Yeah, exactly.
Okay.
Well, and what's your training too? You know, have you gone on to more than just say a weekend course? Because, you know,
you can take a weekend course to do this.
Yeah.
Okay.
Yeah, you can, and right now the guidelines are pretty much open. You know, as long as you feel qualified and that you've taken training in the field, then you're allowed to say, I'm ready to place these cases. Now, again, they're not all easy. So the first question to ask is my case, you know, simple, advanced, or complex? And there's a guideline out there. It was established by the ITI, which is an international, it's an independent international research team. They've actually developed the guidelines, and the dentist should be able to tell you. But, you know, in order to keep it kind of clear, if it's not a bone grafting case and it's not in an aesthetic zone, like in other words, you see the gum line, and it's 1 to 2 implants in good bone height, that's simple. You know? Okay. By simple, we actually mean straightforward because the terminology technically is straightforward, but lay terms is simple.
But back to problems. You said you're seeing about 2 patients a week. These are coming from other dentists that did the work. Is that correct?
Yeah, and some of it's from tourism dentistry as well. So it's, I mean, not necessarily.
You don't like tourism dentistry.
Well, I just think that
it sounds good sometimes, by the way.
You know, if I was a layperson, I would think, hey, I could go to, you know, some sunny, warm country,
Cancun or whatever.
We live in Canada, right?
All right.
I mean, we live in 8 months of winter.
But it's less there.
It is, yeah. Well, it can be, not necessarily always. We had one case where, in fact, the prices were the same, and it was a total disaster. But
like what?
Well, this one young gal went to get 4 implants done, and it was done in extraction immediate placement. But if you look at the tomograph, which is a 3-dimensional X-ray, on the teeth around the areas where they didn't do the implants, so she had like 5 or 6 teeth on the back there somewhere, and on the X-ray you could see the bone plate would have been super thin. So right away that's kind of not a great case for an immediate. And then on top of that they did a tapered aggressive implant which compresses bone, and again, so another selection error, and all the bone is gone. And you know, so you've got somebody now young, vibrant, and we pretty much can't even solve the case. Like, we could maybe do some bone grafting, maybe get a denture, but no, we're not going to have teeth in that situation.
So in the long run, it's a lot more.
Well, the cost of fixing that case is 4 or 5 times the cost of what might have been a normal case. Yeah, and
but you could have done the same thing.
Yeah.
What she went to this other country for about the same price?
Well, it turns out when we actually talked to them and found out what the price was, our prices were the same. Which kind of really surprised me, because that's really the shame in the sense it wasn't even a savings. But let's say that it is a savings. Let's say that you can go somewhere and get it done for half price. You know, what's the business model of say a border town dentist is I'm going to see you, I'm going to do the implants, and then I'm never going to see you again. So in my mind, it's about getting the case in and out as quick as possible. So I'm not necessarily planning for long-term success. And there's times I look at a case and say, we could do this as an immediate case, but, smoker, diabetic, maybe thin bone, maybe some other factors. We would say, load issues like heavy grinders. We're not going to do immediate in those cases. But I'm thinking because I want to see them in 5 and 10 years as a success. But if my industry is border town and I'm just seeing people in and out as fast as I can for cheap, because that's my model, then I've got no long-term investment in making
and
success.
somebody has to fix the problems then in Canada.
Absolutely.
My father, I didn't tell you this, my father got dental implants. He's had at least 5 adjustments on his dental implants.
Right.
And now it's great.
Yeah. But
you'd have to fly.
Yeah.
So it would have been a lot more expensive.
Yeah.
Because he wanted to go to Mexico as well.
Yeah.
I said, please don't.
Yeah.
Just because, guys like you are trying to tell me that, things could go wrong in the hands of inexperienced
Well,
guys.
and to be fair, when I go to these international meetings and we'll see dentists from other countries, there's a lot of really good and well-trained dentists there too. And it's not so much that you can't find them, but they're probably charging about what we're charging. In other words, the best of the market
That's good to hear, by the way.
So it's not like a country issue. It's more like if you're shopping for discount and instant and people who don't follow up, then you're going to get discount.
So go there for
no
vacations, but don't go there for your medical or dental procedures oftentimes.
Yes, exactly.
Okay.
Yeah, because the bottom line is, even well done, so there's this one research by Petruson that looked at 10 and 15-year studies on complications, right? And even well done, there's very high success rates. First off, implants are surviving 95% and over, right? But that means 5% don't. So what happens when and that's in a good university-based study, over 8,000 implants that were followed. In that situation, if 5% are failing, what do you do, right? But now let's take a look at a full arch fix. Say you went down there to get the whole teeth out and put the bolted denture down. The complication rate, even for maybe minor stuff, like you said, your dad had some things that needed fixing, that kind of fix it up rate is about 50%. So half of the cases
So half of the cases need some adjustment.
Some kind of fix up, like maybe
That's interesting. I didn't know the numbers were that high.
Broken screws or chipped porcelain. Chipped porcelain alone is 15% or something like that. Screw loosening rates 5 to 7%. So you're looking at not a one-time purchase. This is more like buying a house where you need to maintain it.
And doctors usually warranty their work in Canada, right? So if you're going to do the work, you're going to, for the basics.
I don't think we can warranty work in the sense, from the point of view of ethics, we're allowed to stand behind our work.
That's what I mean
to
say.
Yeah.
So you could stand behind it.
Yeah, we would encourage patients to come back. Like we have a kind of a track system where we try to get patients to come back, on a follow-up.
Like adjustments or whatever.
And or have the dentist send the x-ray to us so that we can know that the case is still running stable.
And I'm sorry to interrupt, but for the sake of time, guided surgery with computer-generated surgery.
Yeah.
Hasn't that lowered the fail rate, though, of the problems? And do you do guided surgery?
Well, we don't do full guided surgery. So let's go back to the first question.
Because it sounds easy, by the way.
Yeah, it does.
Surgery.
Like think of it almost a paint by numbers kind of scenario. But let's say that, yes, guided surgery, and for that matter, any of the new technologies have improved implant success rates overall. So we look at the modern surfaced implants changing and everything else. So we've moved from, say, 90% success rates up to 95% success rates. But when you look at guided surgery, in what they call the full guided mode, so that means you do a 3-dimensional image that looks like a CAT scan, and you make a plastic shell that you follow the drill steps 1, 2, 3, and literally it's mechanically anybody could do it. But the problem is you're basing things on a number of errors, the errors that are inherent within the image system, and then also the errors in placement on the stent. And when they looked at the deviation, the mean deviation of errors, like a study by a guy named Cassetta looked at something about a 2% error average, 1.9 millimeter average error. Now, if you think about that, that's about 20% of the length of the implant, because an implant's usually 10 millimeters. It's like me parking my car in the garage and getting the front wheels through the drywall.
Okay.
So if I'm off by a factor of 20% on my depth of placement, that could mean I'm near the nerve. Or maybe what it is I say, no, you can't have an implant here because there isn't enough safety zone. When in fact, doing it manually, we can get within a 0.5 millimeter. We've been doing 6 millimeter implants in 6.5 millimeters of bone. We're just working on UBC with a study on that right now, using short implants in the posterior, where those cases would have been said no to with a guided surgery. So guided simplifies it, but it has actually
it still
more
depends
risks.
on the practitioner that's doing
Yeah.
the surgery.
Well, even actually with guided surgery, there's another study that looked at whether experience matters, and even with guided surgery, experience matters. And currently, there's a new trend right now.
But switching gears, the positive side of dental implants.
Yeah.
When done appropriately, on the right candidate, the right diagnosis.
Yeah.
You say you're changing people's lives.
Oh, totally. Yeah. I mean, you know, we have this one guy. It was back. He survived through World War II as a young child, and then the very hard years in some parts of Europe after, and then he became a successful businessman. And you know, when he had some success in business, he decided he's going to get back his teeth. And this guy loves life. I mean, my wife and I were in the parking lot the other day at the grocery store, and he comes running across the parking lot to say, "Hi, I'm his patient, and I'm so glad to meet you. You have a wonderful husband because he's changed my life." Yeah,
so why? Because I mean, the
he
biggest
enjoys
benefit they can
food
eat.
again.
Okay.
He can smile with confidence. Like it's pretty enlightening to see that change. And you actually see it when people are hiding something. You'll see they're not going to smile the same way. If someone's really, their eyes light up, their smile lights up. It's almost like, when you've changed their hair color or something, and people don't quite know what it is, but something is different and something is better. And so it's really impact on their life.
Now, why get a dental implant over? So let's just say you're missing a couple of teeth.
Yeah.
Why get that over traditional dentistry, like a bridge?
Like a bridge, yeah. Well,
which work and are effective.
Yeah, and in fact, even from a study perspective, they're pretty comparable in some of the shorter timelines. But the problem is what are you doing to the adjacent teeth? So
So if you're missing one tooth, how does traditional dentistry take care of it, and what are you doing?
What we do is we take this and we carve it down to be about a third of its width. And then we put so you think of it like you're going from something that wide to that wide.
On the two teeth on both sides of the missing tooth.
And a lot of times that ends up jeopardizing the structure over the long term. So they might work kind of in a 10 and 15 year timeline.
So they're supposed to last about 10 or 15 years.
That's about right. Yeah, because beyond that, what happens is root canal problems or fractures, or sometimes cavities happen under margins. And especially as you get older, dry mouth, you start to get cavities under margins more. So again, the implant makes a lot more sense because you don't damage other structure.
So if you're missing just one or two teeth, every expert would agree that ideally that a dental implant is the way to go?
I think that every expert would put that on as kind of their number one on their list, and then you look at reasons not to do it. Like maybe the other teeth need fixing, and so if they both needed crowns, then a bridge might be a cost-effective, reasonable choice. But in a sense of which is the best option, down the list, single tooth implant, one or two teeth implant, even more so long spans, because when you start getting 4 and 5 teeth, there's no bridge option.
Okay.
You have a denture to choose from, or you have implant options.
You're big on ask your general dentist. Ask the dentist.
Yeah.
They'll tell you.
Yeah, they can give you all of this. I mean, it's all taught in dental schools now. Every dentist coming out of dental school is going to have some training in implant dentistry for sure. So they'll be able to answer some of those questions.
Now, you live in an area. Where's your practice, by the way?
In Calgary.
In Calgary.
Northwest. Yeah.
So it's a
Market Mall.
I think we talked. You said it's like in their 50s. They're healthy people in that town. But are they missing teeth? Are there people out there with missing teeth?
Yeah. Calgary's a pretty vibrant community. I think I read somewhere in a survey that Calgary's average age was like 35 or something, because we get a lot of young engineers moving into town.
But those people that are missing just one or two teeth, and maybe they have a bridge.
Yeah.
Is there any prevention aspects with dental implants over?
You mean, does dental implants help provide maintenance of structure? For sure, yeah. I mean, the best studies to look at those are atrophy studies. If an implant's present, the bone is maintained. If an implant isn't present, bone atrophies. Bone has to have a reason to be somewhere.
So the spot underneath the missing tooth is slowly dissolving away?
It's going to break down, for sure. Yeah.
Interesting.
And what happens in the absence of force, bone basically will remodel. And you could think, well, a denture's putting force. But a denture doesn't put the right kind of force. It puts pressure. So bone responds to tension. Think of it like, girders or fibers. If I'm tensioning them, they're going to be building. If I'm pressuring them, they'll disappear. Okay. So a denture actually would speed up the problem in terms of bone loss.
So we're out of time completely. To the denture wearers, for sure, they got to come in and get evaluated, right? No more dentures.
Yeah. Yeah.
Okay.
And think think about whether you want fixed or removable, and be careful about selecting in skill set, because these are complex cases. By definition, a full arch case is complex.
And you don't have to rush it. Like this teeth in a day, possibly not everybody's a candidate.
Well, you know, and it
Like
works
wait
in
a
some
few
cases.
weeks sometimes.
Well,
All right.
you know, you can do certain cases can be done immediately, and we've done that, but it's not every case. And the most important thing to think about there is what's the advantage for the time change versus what's the risk. Because anytime you do something like that, you're adding risk. You know, there's a risk that the implants get disabled or displaced early, or that you have that periimplantitis infection transfer that we talked about. So, you know, look at it and say, what's the advantage? If I've had dentures for 10 years and I'm going to go to do implants, does it make a difference if I wait 8 weeks for the implants to integrate, or do I do it all in a day? It's probably not going to make a difference, right?
Okay.
But if I'm missing one front tooth and it needs to be taken out, could I do an implant the same day and build a crown on it the same day, at least a temporary? Yes, we can do that. And that's actually kind of our normal protocol for those cases.
Oh, good.
So immediate teeth in a day, it all kind of depends on case by case.
Okay. And I want to thank you for coming on the show. We're out of time. Final message, though, to somebody that's missing any type of teeth, that they have more questions. What do you say to them? Just come in?
Well, I mean,
Gotta-
ask your dentist, and
Okay.
if you're going to do the internet, try to look at sites that are university-oriented or institutional, like the Academy of Osseointegration or the AAP, Academy of Perio. You know, go to reputable sites for the information.
All right, good. And you've been, this is your life's work. I mean, you eat, breathe
Oh,
dental
yes.
implants.
On my weekends, because again, as I said, I'm putting together this paper on this you know, implant database that we've been tracking now over 15 years, and trust me, this is going in on weekends and scoring bone scores on every case I do. So I don't just do them; I look at every single one afterwards and find out what my success rates are.
Talk to your wife. She's in studio.
Yeah.
She says you always talk about dental implants.
Yes, yes.
So you love it.
She knows as much about implants as I do, I think. Yeah.
All right, I want to thank you for coming on the show.
Okay.
And they can go to your website and find out more. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, if you just caught 5 minutes of it and you want to direct a friend to it, go to wellnesshour.com and just put in Dr. French. You'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.